Hello, welcome to Look East.
In the programme tonight, calls for a police investigation into the unexplained death of a young mother in a hospice.
It's extremely concerning. I will be writing again to the coroner and to the police in the light of the evidence that the BBC has uncovered.
Two divers lucky to be alive after exploring this wreck off the coast of Norfolk.
First it was ash dieback, now our oaks are under threat from a new disease, and once again the East is in the front line.
And life after Strictly. Lewis Smith is back at his gym with a book to sell.
First tonight, the case of a young mother whose family say she died because she was given an unexplained dose of morphine while in a hospice on the Liverpool care pathway.
35-year-old Andrea West died in Norwich just under a year ago. Her family were told she died of cancer, but they refused to believe the experts. They commissioned their own autopsy and discovered significant levels of morphine in her body. The drugs had not been prescribed and had not been entered on her medical records. Once again, it puts the Liverpool care pathway in the spotlight. The pathway was introduced to allow people to die with dignity, but some say it's led to substandard care. In this case, BBC Look East has since commissioned its own pathology report, and our experts also found morphine. This exclusive report from our Home Affairs correspondent, Sally Chidzoy.
Andrea West was 35 when she died unexpectedly last September. The funeral for the mother of 6 was held in Norwich. It was delayed as her family asked for her death to be investigated. Diagnosed with cervical cancer, Andrea was nevertheless expected to live for 2 years. She only went into the Priscilla Bacon Lodge hospice for symptom control and infection treatment. Her family thought she'd be in the hospice for a few days. The day before she died, she was alert. The following day, she was heavily sedated.
Next morning at 8 o'clock, I get a phone call to say, get myself to the hospital quickly. Andrea's taken a bad turn in the night, and we don't think it's going to be very long before she goes.
Andrea's husband, Chris West, says he feared she'd been put on the Liverpool care pathway, in which drugs, usually morphine, hastens the death of dying patients.
I spoke to one of the nurses there who thought I knew about the Liverpool care pathway and what they were doing. She actually admitted to me that she was on the Liverpool care pathway. And when I said to her, I want you to stop what you're doing and the medication you're giving to her, she turned around and told me, well, you need to speak to the doctors, which I did, and they wholly denied that they were giving anything to do with the Liverpool care pathway.
So Mr West asked the Norfolk coroner William Armstrong for an autopsy and an inquest. Mr Armstrong declined, saying he understood Andrea West died from cancer. In the end, the coroner did instruct a pathologist who concluded her death was caused by cancer. We understand the pathologist didn't have access to Andrea West's full medical records. Chris West decided to seek another medical opinion. The BBC can reveal that a report by an independent pathologist commissioned by Chris West concluded that, on a balance of probability, it was morphine and other drugs that killed Andrea West, and not cancer. The drugs were given to her shortly before she died at this hospice. But there was no reference in Andrea West's medical notes to morphine being administered. By law, it should be recorded in her prescription drug chart and in a separate hospital book. Mr West's pathologist, Michael Yomolovich, wrote to the coroner about his concerns over the lack of medical notes, telling him, I do realise the implications of the suggestion I'm making, but in all conscience, I can't ignore the interpretation of the data, hence my reporting it to you. The BBC asked a third pathologist for his opinion. Dr John Grant agreed with Dr Yomolovich, saying that cancer did not kill Andrea West. The Health Trust told the BBC Andrea West was not on the Liverpool care pathway, but Andrea West's GP says he was told she was. Chris West is seeking political asylum in America after telling lawyers he received anonymous threats after questioning his wife's death.
Should have some justice in finding out what actually happened, not just for me, but mainly for these lot here.
Andrea West's family say a police investigation is the only way forward. The coroner said tonight his scientific inquiries were continuing. Sally Chidzoy, BBC Look East, Norwich.
Well, as you may have heard, the Liverpool Care Pathway will be phased out over the next year. The government has concluded that doctors have used it as an excuse for poor quality care. It's a subject Look East has covered many times. In February, we revealed that more than 10,000 people in this region have died on the pathway over the last 3 years. Plenty to talk to the Care Minister, Norman Lamb, about. And I started with his reaction to the case of Andrea West.
Well, obviously it's extremely concerning, and I've met with the mother-in-law of the woman concerned, and I will be writing again to the coroner and to the police in the light of the evidence that the BBC has uncovered.
So you believe that the police should make this, what, a criminal inquiry?
They have to look into that. I don't ultimately know everything that happened, but I understand on the basis of what the BBC has uncovered, the basis of this additional pathologist report, that there is obviously a substantial concern here that has to be properly investigated, and the police, I think, have to undertake that.
What about the use of diamorphine? Because in the case of Andrea West, diamorphine seems to come up time and time again in these cases. Do we need greater controls on it?
Well, this independent review has looked at that very issue, and there have to be absolutely clear guidelines about its use, but about all aspects of care at the end of life. And one of the things that has clearly emerged from this review is the fact that the quality of training has been inadequate in many places. And if staff don't really know what they're supposed to do at a highly sensitive, highly emotional moment for the family, then we have a duty, a responsibility to improve that, to ensure that every person gets a good, dignified death.
Are you quite content in your own mind that people haven't been moved into death quicker than they should have been?
Well, look, some of the concerns of families is that their loved ones have died inappropriately or prematurely. And I want to ensure that every family who has a concern about the death of a loved one has the chance to have their case assessed by an independent person, a specialist, so that they can feel satisfied that their concerns have been properly addressed.
That accepts that some people in the care of the elderly have actually been helping people to die sooner than they should have done.
I don't think this is an intention to speed up death, but I think
You don't think it's an intention to free up beds and to save money?
Anything like that would be so utterly shocking, unimaginable that anybody, any administrator or doctor could think about ending someone's life to free up a bed. That is just unimaginable. But what I do think has happened is because of poor training, inadequate training, some professionals haven't known enough about what they're supposed to be doing, or the inappropriateness of the use of diamorphine in some cases, or the inappropriateness of denying liquids or food to someone at the end of life. That is inhumane. If someone wants to drink or to eat, they should be able to do so. It should, as the review says, be the patient's decision, not a clinician's decision.
See, somebody said to me that actually part of the problem with not having enough beds earlier this year was because people were shying away from the Liverpool Care Pathway, which indicates that people were still alive when the Liverpool Care Pathway might have killed them.
Well, look, all I am concerned about is to ensure that every individual, all of our loved ones, have the best possible care in hospital across our region and across the country. And
do you not think they've been getting that?
Well, no, in many cases they haven't.
It's more than changing a name, though, isn't it? You're going to drop the name, the Liverpool Care Pathway, but still there is this end-of-life care.
This is an evolution. Actually, the introduction of the Liverpool Care Pathway for very many people meant at least a framework for dealing with people at the end of life. Before that, there was nothing, and some of the cases of care at the end of life were awful. But there needs to be this evolution. We need to learn the lessons of where it has failed and be open and honest about that and improve it. And so that means condition-specific guidance. So if you're dying of cancer or a respiratory problem, the care you receive must be appropriate for you and for the condition that you're suffering from.
Norman Lamb, thank you.
Thank you.
And tomorrow the focus within the NHS will turn to the unexpectedly high death rates in some of our hospitals. 14 hospitals are being investigated across the country. 2 of them are in Essex, Basildon and Colchester. Kevin Birch is in Chelmsford now.
Yes, Stuart, what we'll get tomorrow around about lunchtime, we think, is individual reports on each of these 14 hospitals, notably these 2 in our area, Basildon and Colchester, as Sir Bruce Keogh and his team have spent months looking at this, tried to answer the key question: why is it these 2 hospitals? They have similar sized populations, about 400,000, similar budgets, about 250 million a year. Why is it that not just as a bit of a one-off, but for some time these mortality rates have been too high? Now, when Sir Bruce set out the remit for this, he set out 3 possible options. One was that what they were doing so far was enough to put the problem right. 2, did they need some kind of external help? 3, did they need a bit of a regulatory clout to try to get them to sort this out? Now, the hospitals say they're doing enough. The families who've been involved, who've lost loved ones in often tragic circumstances, say things have got to change. Now, we'll have more on this in our late bulletin tonight at 10:25 with an MP and a campaigner, and of course, across tomorrow, extensive coverage with the key players.
Kevin, thank you very much.
2 divers are lucky to be alive after they lost contact with their boat off the Norfolk coast. The men went missing on Saturday off Sea Palling, sparking a full air and sea rescue operation. They were finally rescued by another diving team, which happened to be in the same area.
There are some 500 shipwrecks off the Norfolk coast. Divers come from all over the country to explore the seabed. It isn't exactly a dangerous sport, but it is not without risk. And on Saturday, Jim Moore, co-owner of the dive boat Manta, was right in the middle of a rescue operation to save 2 fellow divers. Jim was diving off Sea Palling, which on Saturday was shrouded in a sea fog. Another boat, the Meerkat, had apparently lost contact with 2 divers who were on a wreck some 7 miles out. The divers, out of oxygen and floating some distance from the wreck, were found by the Manta.
It could have been a lot worse than it was. I know local lifeboats were scrambled, and the helicopter, which would use a thermal imaging camera, but even so, they're still a very small object. It's a needle in a haystack.
Cromer lifeboat was one of the boats scrambled by the Humber Coast Guard. In the end, the lifeboat wasn't needed, but the lifeboat's coxswain is warning divers to take extra care in bad weather.
When they're diving and they're down on the seabed, they may just have one person in the boat at any one time, and when they're underwater they don't know how the conditions have changed up top. So when they're coming up to surface again at their allotted time, if there's a fog bag come in and you're within 25-30 yards of that boat when you come up, you could miss that and they could miss you.
You don't want to leave divers unattended, because if one of them had to come up from the wreck for whatever reason, away from the marker buoys, you need to be there to spot them and recover them.
We tried without success to contact the crew of the Meerkat today, but from what we know, it's quite clear that this story could have ended very differently. Mike Liggins, BBC Look East, Sea Palling.
2 homeless people who murdered a man in Ipswich have been jailed for life. The body of Christopher Thompson was found in Chantry Park in November. He'd been beaten and strangled. Christopher Wilson and Deanna Stanton blamed each other for the death.
A third of this region is off limits for renting a house for